Okay, so last time we ended in looking at the muscles of the forearm that flexes the wrist and the fingers. And then we saw the anterior compartment, the posterior compartment. We said that the anterior compartment has flexors, posterior compartment has extensors. And that's in general, even for the arm. So everything here anteriorly flexes. So the biceps, the brachioradialis flexes the elbow, and then all these flexors of the forearm will flex carpi fingers. And then everything here posteriorly extends. And then of course we have pronators and supinators that do a different function, but we already saw them. And then we said that we have the extensors of the carpi on the sides, either ulnaris and radialis, protecting the extensors and flexors of the fingers medially. Because it's more important being able to do this function than doing this function. Okay, just in case that you cut the edges of the forearm and then you damage your muscles. And so we have all these tendons from all these muscles, the extensors of the carpi and the digits, which do this and do this. We have them crossing the dorsal wrist. So this is the dorsal wrist. And then remember that we have the flexor retinaculum and the extensor retinaculum. So we have here the extensor retinaculum and the flexor retinaculum here that forms a band. And that band allows the passing of the tendons. So these tendons that we have here and here, so that they slide easily as they're performing their functions. And now why the physiological position is having our flexors posteriorly and not anteriorly? Well, for the same reason. When we walk, if you cut yourself, you cut the extensors, the digits, or the carpi, extensors of the digits or extensors of the carpi, but you protect the flexors, which are more important for grabbing food and putting into your mouth. Does that make sense? So that's the physiological reason behind why we have the moving of our hands like this while we walk. And then these muscles, the extensors, are innervated by radial nerve and its branches. So the branch of the radial nerve that innervates these muscles will be the posterior interosseous nerve. And then something that happens when someone has damage to the radial nerve for whatever reason, the most common reason is because someone has a fracture of the humerus. And remember, we have the radial groove that allows the running of this radial nerve, especially in the shaft of the humerus. So typically people, when they break this and these bone fragments displace or they move out of place, they damage this nerve. So the person end up with what is called claw hand, and then they have a drop in the wrist. I have seen rock and roll players, like they used to sing and play the guitar, and then they end up not playing the guitar anymore because they have had damage to this nerve. Okay.
That nerve supports the wrist really a lot.
Mm-hmm. I thought that you were going to tell me the name of the guy. I will tell you later after the video. But it was sad. Okay, I mean, it's what it gives the rock and roll players money, right? They still sing. They hire a guitar player, but it's sad to see after years of doing that they have to depend on someone else. Okay. So then that's what happens with damage to this radial nerve. And then you can see here, as we saw before, these superficial muscles and deep muscles in this extensor area, the posterior area. So here we have extensor carpi ulnaris, and then here we have extensor digitorum, and then we have here the extensor carpi radialis brevis, and then we have extensor carpi radialis longus here on one side. And then we have here a specific extensor for the digiti minimi. Extensor for what finger will be that? And don't, it's not the middle. Extensor digiti minimi. What does that sound to you in your mind? Yeah, so we have a specific extensor for this. It's hard to isolate it. Well, so I can do this instead of all together like this. I will tell you something after the video too. Anyway, so then here we have also another extensor specific for one finger, and we have two actually, but we have the brevis in here and the longus in here. So these are extensors of the pollicis. So will be this one, right? And then, I don't know if it's, oh, here it is. It's deep, but it is important. Like we have extensor indices. And look how it goes from this part of the ulna, from the lowest part of the shaft, up to this distal phalange of this index. So that's the one that we use for pointing. That's a trigger finger. So then this is the extensor indices, and then we have extensor pollicis longus and extensor pollicis brevis in this region. And then we have the abductor pollicis longus. So it does this. It separates the pollex. And then we have supinator here, and then we have the anconeus. Do you remember the function of the anconeus? It's very tiny, but it is a synergist of one muscle. It helps for extending the elbow. Even at this little region, look how it connects here to the humerus, the distal part, and this tiny portion of the olecranon process. So, and now, tell me, based on this, these are the deep muscles of the forearm. Tell me, based on what you have heard from me before about functionality, which of these muscles, abductor pollicis, extensor pollicis brevis, longus, and extensor indicis, is the most fragile and the most important to protect? Because of that, it's in that position. So what function do you think is more important to protect?
The grabbing function, right? To grab.
Look at the names here, all extensors. Pollicis, indices, and then abductor pollicis. So either is the abductor pollicis, this one that does this, the extensor pollicis brevis, which it does this, or the extensor indices, which it does this. So what function is more important? Abduct? We're not talking about texting, okay? So it's more important doing this, extending, abducting, or doing this. What is more important according to what you see there? Guys, you love texting. You keep saying this, and I said, no, it's not about texting. you, pointing. Incredibly enough, guys. Why we have it in the middle? Why it's protected by the extensors and abductors? It's not good, right? When you're like, oh, this person do this, that's not right. But, well, I want this. Or this is how it looks. Like, this is the monitor, this. For certain things, it's good to use this, pointing at things, but not criticizing. Okay, so those were muscles of the forearm. And of course, you expect, as always, anything that is superficial, of course, is still important, but it is less important than something that is deep. So we protect something that is deep with the superficial, and then within the deep or within the superficial, we always keep in the middle something that is important to protect. Okay, and the rest is kind of in the edges. And it depends on what you're talking about. But anyway, for muscles of the hand that moves the fingers. So we have here in this region, the thenar region, and this is the hypothenar region. So in the thenar region, we have the muscles that move the thumb. So we have abductor pollicis brevis that abducts this, the thumb. And then we have flexor pollicis brevis. And then we have opponents pollicis brevis and adductor pollicis brevis. So basically you have the combination of the four functions: abducting, adducting, flexing, and then opposing. So, I mean, I told you before about us as primates being able to do this. Humans are able to oppose. Other primates, they are not able to do so. So they don't have this line that shows that we have this function. I don't know why, but basically in people who have Down syndrome, they don't have this line. But they have these other lines that shows in our palm that we are capable of flexing and extending our fingers, okay? And then in the hypothenar region, so these are muscles that help us to move our little finger. So we have abductor digiti minimi, kind of, with so much effort. I mean, you have to train it. If you're a pianist player, for sure you have more mobility. But that muscle, abductor digiti minimi, that's what it does. Flexor digiti minimi, we have one specific for this. And then opponents. It's just like as the opponents of the thumb. So we have this that can oppose it. And then lumbricals. These are located between the metacarpals. So it helps to extend the interphalangeal joints of fingers 2 to 5. And then within this area, we also have 2 interossei muscles. So we have palmar and dorsal, that the dorsal ones, these ones, abduct the fingers, spread them apart, while these ones bring them together because the fibers runs in opposite direction. So here are the muscles of the hand that moves the fingers. So we have here abductor digiti minimi, so this is the superficial layer. And then here we have opponents and flexor. So this is the opponents and this is the flexor. And then here we have the lumbricals in between the metacarpals. And then here we have the flexor pollicis brevis. And then we have the abductor pollicis brevis and the adductor pollicis brevis. And then remember what I told you about the flexor retinaculum? This is the flexor retinaculum. So we are looking palm side. And then this is the second layer. So if you remove this flexor digiti minimi and these other other muscles. So you will be able to see this specialized muscle, which is the adductor pollicis. It has like two major heads, one that extends into the deeper part of this flexor retinaculum, and this other one that extends to this third metacarpal. And see how the fibers runs in this direction? Because when it contracts, if you have your finger extended, it brings it medially. So that's adducting. And then here we have the dorsal interosseous. So the dorsal, if you go back, abduct the fingers, and the palmar, which is in the other side, abduct the fingers. It has the other function. So here we have the lumbricals and the palmar interosseous, while this is the dorsal interosseous. Adductor, abductors. Questions? Okay, now let's move to the muscles of the lower limb. So thigh flexors and rotators. So we have this muscle that is part of the iliopsoas, the iliacus, that it is connected into the iliac fossa. That together with the psoas major that runs between the lower vertebrae and the fibers of the iliacus helps to flex the thigh. So if you're in supine position, you can flex your thigh. And then also flexes and laterally bends the vertebral column. So it helps you to do this when you're standing. One of the signs of someone who has appendicitis, it is like the pain on the right side, the right iliac region, makes the person to bend a little bit anterior and to the side. That's the action of the iliopsoas. And in x-rays, you can see the shadow of the iliopsoas when the person is bending toward the right side. And then we have the sartorius. Sartorius flexes thigh and leg and abducts and laterally rotates the thigh. So this is the action of the sartorius, crossing your leg. It is called sartorius because very early in history, people, when they were doing their garments, they used to cross their leg and start sewing by hand. So sastre, it's a person who designs and who sews garments. So that's the sartorius. Flexes the thigh and leg, abducts, and laterally rotates the thigh. Tensor fascia lata, or latae. It abducts, flexes, and medially rotates the thigh, tightens the fascia latae. So this is a very thin muscle, thin muscle, triangular shape that is located in this area, and it has a broad tendon that inserts laterally in our knee. So that's the fascia latae, or iliotibial tract. And when someone tenses this muscle, both bilaterally can stand still like this if it was a soldier. Okay? Now, quadriceps. Quadriceps, it's a group of 4 muscles forming one single muscle that primarily extends the knee. So we have 2 vastus. The fibers, they run medially and laterally. So we have vastus medialis here, vastus lateralis in here, and then in between the 2 vastus, we have the rectus femoris, which fibers runs straight. And then underneath, we have the vastus intermedius. So the vastus lateralis together with the gluteus maximus and then the deltoid are the three muscles that we use for intramuscular injections. Vastus lateralis is preferred muscle for intramuscular injection in children or babies because the size and the bulkiness of the muscle, it is kind of uniform. Gluteal muscles, why not? Well, because the gluteal muscles, we develop them later in life as we start walking. But vastus lateralis is the site for giving the shots to children, to babies. And then functions, all are extensors of the leg. Rectus femoris can also flex the thigh, and vastus medialis and lateralis stabilizes the patella in addition to extending the leg. Adductors. We have thigh adductors and medial rotators. So we have adductor magnus, which is the largest of all the three adductors that has the name adductors as such. We have adductor longus, the second largest, and brevis, the smallest. All adduct the thigh, and the adductor magnus not only adduct the thigh, but also medially rotates the thigh. In the case of all of these, adductor longus and brevis not only adduct and medially rotate the thigh, but also flexes. I guess ballerinas can work these muscles really, really nice, or dancers in general. And then we have a tiny muscle here within this area. It's called pectineus. This pectineus, it has basically the same function of these adductors, adducting, flexing, and medially rotate the thigh. And same for the gracilis, which is a muscle that we have posterior here. So here are the muscles of the thigh. So here is the iliacus, here the psoas, that both of them, they form the iliopsoas, flexing the thigh, and in this case also laterally rotating or flexing the vertebral column. And then here we have a group of the adductors. We have pectineus, adductor longus, adductor magnus. This is the gracilis. And then here we have the adductor brevis, and a better view of the adductor magnus and adductor longus. The adductor magnus goes and inserts into the medial portion of the tibia in the medial epicondyle in what we call the adductor tubercle. And then here we have the extensors of the knee. This is the quadriceps femoris with the three heads that you can see superficially. Vastus lateralis and vastus medialis that stabilizes the patella. And then we have the rectus femoris that can extend, and flex the knee. And then deep to this, if you see it here, we have the vastus intermedius. So this is the portion that it was being cut from the rectus femoris, vastus medialis, vastus lateralis. Questions? Okay, so for the gluteal group. So the gluteal group inserts into the posterior portion of our iliac bone, which is the ala. We have several lines there, the anterior, superior, inferior line, gluteal lines. And then most of them, they end up inserting into the greater trochanter in the femur. So we have three gluteal muscles. We have the maximus, which is the largest, medius, the intermediate size, and minimus, the smallest. So functions of the maximus: extending the thigh, especially from a flex position, laterally rotating, and abducting the thigh. So it can do this, basically. And when we are going through the stairs, this one help us to extend our thigh and also help us to walk. Gluteus medius abducts and medially rotates the thigh. So this one stabilizes the pelvis during walking, same as for the gluteus minimus. So it has the same function. So the only difference between gluteus maximus and the medius and the minimus, it is that these ones, these two, the smallest ones medially rotate the thigh, while these ones laterally rotate the thigh. But all of them can abduct the thigh. Some do the medial rotation, the other one the lateral rotation. Then we have a tiny muscle that is called piriformis, that it is deep to this gluteal group. They abduct and laterally rotate the thigh. And then we have these obturator muscles, internus and externus, that are next to these piriformis that laterally rotate the thigh together with these twins gemelli. That's kind of the word in Spanish for twins, gemelo. We have superior and inferior that laterally rotate the thigh, and quadriceps femoris that also laterally rotate the thigh. Hamstring muscles. So we have three muscles that makes the hamstring group: biceps femoris, semitendinosus, semimembranosus. So all of them extend and flex the thigh, extend the thigh and flex the leg. And then why they're called hamstring muscles? Well, because these tendons end in the knee. And then butchers, when they had like the thighs of the pigs, they hang it from these tendons in the hooks that they had. So this is the hamstring muscles. I mean, the tendons look like a string, and from the ham, which is part of the leg of the pork. So all of these are flexors of the leg and extensors of the thigh. So if someone wants to work out their hamstrings, they have to flex the knee, and then you can feel the contraction of these muscles. If someone wants to work out the extensor or the quadriceps, they have to extend the knee. So here are the view of these muscles from superficial to deep. So here we have gluteus maximus, here we have gluteus medius, and this is the iliotibial tract of the tensor fasciae latae, which it's a little bit more superficial than these muscles. It's not shown in here, but it's supposed to be here in this area. And then we have underneath this gluteus maximus, the hamstrings. So the bicep has two heads, the long head, which is lateral, and the short head, which is medial. And then here we have this muscle that together with this tiny portion is called the semimembranosus. And then in here we have the semitendinosus, just next to this long head of the biceps. And it's not labeled in here, but this muscle in here is called, oh, it is, it's the gracilis. So the gracilis is the most medial. And then we have the semimembranosus, and then we have the long head of the biceps. Now, if you magnify this region and you cut portion of this gluteus maximus, which is this part gone, you can see the gluteus medius, and then you cut part of this gluteus medius, so you can see here the gluteus minimus. And they insert into the greater trochanter of the femur. And then here we have the piriformis, obturator internus, gemelli in here, superior and inferior, and quadratus femoris. And then here we have obturator externus. Underneath we will have the obturator internus. Why they are called obturator? Well, because they are next to the obturator foramen. Questions? Okay, now for muscles that move the foot and the toes. So we have in the anterior compartment of our leg, dorsiflexors and toe extensors. So we have anterior to the tibia, the tibialis anterior, that dorsiflex and inverts the foot. So if you want to feel how this tibialis anterior feels like, all you need to do is doing this and feel how this muscle contracts. So that's the tibialis anterior. And also can invert the foot. Extensor digitorum longus extends toes 2 through 5 and dorsiflex the foot. Dorsiflexion is moving your toes up, plantar flexion moving your toes down. So it is a synergist of the tibialis anterior, the extensor digitorum longus. And then we have extensor hallucis longus that is specific for the great toe, which is also known as hallux, and also dorsiflex. So all of these in the anterior compartment are dorsiflexors, so meaning like you can do this movement of your foot. And then we have a lateral compartment where we have everters and plantar flexors. So they can do this type of movement and also do this. So we have the fibularis muscles, longus and brevis, that they have the same function, everting and plantar flexing the foot. And now in the posterior compartment, we have the plantar flexors and inverters. So we have the gastrocnemius and soleus, that the three of them are called triceps uri. This gastrocnemius has two heads, the middle head and the lateral head. They form the shank. And then this one plantar flex the foot and flexes the leg at the knee. This one only plantar flex the foot because this one inserts solely in the tibia, while this one goes and inserts superiorly in the femur or proximally. But the three of them, they form the triceps uri, and their distal insertion of the three of them is in the calcaneus using the Achilles tendon or the calcaneal tendon. Achilles was kind of a warrior in Greek mythology that it was protected all over his body. When he was born, Achilles, he was dipped into the sea to have protection of his entire body. But the god who dipped him into the sea, he grabbed him by the heel. So the heel was the only part that wasn't deep into the sea, so that was his weak point. Guess how he lost the battle? With a cut, with the sword in the heel. He cut his tendon. So because that was his weak point, and he died. So that's then the insertion of gastrocnemius and soleus in the calcaneus by the Achilles tendon, and then, or calcaneal tendon. And then we have the plantaris, which is basically the synergist of the triceps uri, assisting plantar flexion of the foot. And then we have the tibialis posterior, which is antagonist of the tibialis anterior, because inverts and plantar flex the foot. So if the tibialis anterior does this, the tibialis posterior does this. And then it does this. So popliteus, it flexes the leg and unlocks the knee by rotating the femur. It's located here in the popliteal fossa. So here we have anterior and lateral view of these muscles. So this is the tibialis anterior, and this is the anterior view of the soleus and the middle head of the gastrocnemius. And then here we have the lateral compartment, so we have the fibularis longus here, and fibularis brevis is in here in this area. This one. And then here we have extensor hallucis longus, just specifically for the hallux or the great toe. And then we have the extensor digitorum longus that extends all the toes from second through fifth. And then here in the lateral compartment, what you can see is the fibularis longus, fibularis brevis in here, extensor digitorum longus, and then tibialis anterior, and the lateral head of the gastrocnemius. And then underneath, we have the soleus there. So this is a posterior view of the leg muscles, gastrocnemius, middle head, lateral head, and then this is the calcaneal tendon. If you remove these two heads, you can see here the soleus, and then you can see the popliteus here, and the plantaris. And then if you remove part of these muscles, including the soleus, you can see the deep posterior compartment, which is the tibialis posterior here, and the flexor digitorum longus. And then here we have the fibularis longus and fibularis brevis. Questions about these muscles? Okay, so muscles of the dorsum and plantar aspect of the foot. So in the dorsum, or the top part of the foot, we have extensor hallucis brevis and extensor digitorum brevis. So extensor hallucis brevis only extends the big toe, while the digitorum brevis extends the rest of the toes. And then in the plantar aspect, or the sole of the foot, we have abductor hallucis, which abduct and flex the big toe. And then we have the flexor hallucis brevis that flexes the big toe, flexor digitorum brevis that flexes toes 2 to 5, and abductor digiti minimi that abducts the little toe. So it's similar to the muscles in function of the hand. And then we have in the middle of the sole, we have a muscle that it is wide and it looks like a square. It's called quadratus plantae, that it's a synergist of the flexor digitorum longus. So it helps to flex the toes. And then just like as in our hand, that we have lumbricals that are located between the metacarpals, in the foot we also have lumbricals that are located between the metatarsals. It keeps the metatarsals together. So flexes the metatarsophalangeal joints and extends the interphalangeal joints. Now, similarly, as to the wrist, we have also retinacula, collagen fibers that forms like a little band that protects these muscles and their tendons. So we have superior and inferior extensor retinacula. And then here we have extensor hallucis brevis and extensor digitorum brevis. And then this is like the plantar view. So you cut the aponeurosis of the plantar muscle here, and then you can see here the flexor digitorum brevis that flexes toes through the 5. And then here we have the flexor hallucis brevis. And you have here abductor hallucis, and in here we have abductor digiti minimi, and then we have flexor digiti minimi brevis here. Those were the superficial muscles of the plant. Now for the deep muscles, we have here the quadratus plantae, that is a synergist of the flexor digitorum. And then here we have the flexor hallucis brevis. And then you can see still the flexor digiti minimi brevis. And you can start seeing the lumbricals here. And this is the transverse head. And this is the oblique head of the adductor hallucis, which is deeper than the flexor hallucis. And this muscle in here is the flexor hallucis brevis. And then we have dorsal interossei and plantar interossei with the corresponding actions to the interossei that we have also for our hand. So one abduct or spread the toes apart, and the other ones bring them together. Now, for the next chapter, we're going to see the histology of muscle tissue, the physiology, and we're going to see the structure of skeletal muscle more in detail. We're going to see the contraction of skeletal muscle, how it happens, and we're going to categorize the tissue type based on the metabolism that they have. And we're going to see as well, again, the differences between the 3 types of muscle that we have. So for your test your knowledge questions, multiple choice. Which muscle is the prime mover for elbow flexion? Triceps brachii, biceps brachii, or deltoid? Yes. What lever class is the elbow joint during flexion? First, second, or third class? Skip that one. Forget about the lever systems. Okay, so true or false? The sternocleidomastoid rotates and flexes the neck. True. The quadratus lumborum is located in the neck. Lumborum. False. It's here. Synergistic muscles oppose the action of the agonist. True or false? It's false.
Assist, right?
Synergist aid or assist the prime mover. Short answer, name 3 components of a lever system and explain their roles briefly. I'll give you one, fulcrum.
What's this as an advantage, right?
So levers helps to reduce work, right?
The force.
Force is another one, another component. So we have fulcrum, force, and what else? Load. So what is the purpose of the fulcrum? Provides a pivot, an axis for movement, right? What is the purpose of the force? To carry the load, and the load, no purpose, just wanted to be carried. Okay,